A referral by your specialist or GP will lead to your first outpatient appointment at the spinal surgery unit. Here you will be seen for a preliminary assessment by one of our leading surgeons. Once you have answered the questions which will lead to a diagnosis, we will assess your condition and, if necessary, recommend you for surgery. Whilst in the clinic, you will also see a nurse who will take some swabs to make sure you are clear of any infection. To keep you fully informed, you will be told what will happen to you as an inpatient at Stanmore. From your first outpatient appointment until discharge, we will ask you questions about your experience, pain and levels of functions, which will be recorded on an iPad. For further information on your condition, we will provide you with a patient information leaflet. At the preoperative assessment, we check if you are fit for surgery. You will also have a further chance to discuss surgery with the medical team, who will be happy to answer any questions or address any concerns you may have. Once you are happy, your consent for surgery will also be taken. On the day before admission, ensure you have nourishing meals and drink lots of fluids. This will aid your recovery following surgery. Make sure you bring the following items with you. Upon your arrival at the admissions lounge, we will tell you about the ward and its location. Once at the ward, you will be greeted by a ward nurse and asked to change into a hospital gown, stockings and briefs. The nurse will check your general well-being, and members of the team will confirm that your consent form is correct and answer any last-minute questions you may have. We will also explain and talk to you about the anaesthetics you will have administered. The nurse and a porter will take you to the theatre, where another member of the team will meet you and talk you through the anaesthetics. The anaesthetic team will gently guide you off to sleep. You then have your surgery. When you wake up, the first person you will see is the recovery nurse, who's there to make sure you're okay and in no pain. You will go to the high dependency unit overnight for monitoring and return to the ward the next day. We will closely monitor your well-being and provide you with a button, which on pressing will deliver pain relief. You will also have pumps attached to your lower legs, which will help reduce the chance of developing blood clots. A catheter will be in situ to allow you to pass urine whilst you are less mobile. A member of the team will come and see you after surgery to explain what took place. A physiotherapist will come to see you at the earliest opportunity to get you up and out of bed. This is very important in order to minimise post-operative complications. During your stay, we will switch from intravenous to oral pain relief to help with early mobilisation and encourage you to independence throughout your hospital stay. The occupational therapist will explain the precautions after your operation and will advise you with regards to managing daily activities, discuss returning to work and sporting and leisure activities. Depending on your procedure, you may have to use a brace for 3 to 6 months after surgery. This will be made and provided to you by our orthotics department. We will show you how to put your brace on and off prior to being discharged home. Once you are able to get yourself in and out of bed, mobilise safely and independently on the ward, and also manage stairs, you will be deemed safe for your discharge home. When at home, please remember to change your position regularly and walk around freely. 6 weeks after your surgery, you will be seen by an outpatient physiotherapist to teach you abdominal and back strengthening exercises. However, if you are in a brace, physiotherapy does not usually commence until this is removed. This will be discussed before you go home. You will be required to wear your anti-embolism stockings for 6 weeks post-operatively and be asked to visit your GP practice 10 to 14 days after surgery to have a wound check and, if necessary, your clips or sutures removed. We will also advise you to gradually reduce your levels of pain relief with guidance from your GP. Your first appointment after surgery will be in approximately 6 weeks' time, when you will see the consultant or a member of their team to discuss your progress. We will send you for an X-ray, so please ensure to arrive 15 minutes before your appointment. You will be followed up for up to 2 years or more after your operation. Once your treatment has been deemed successful, you will be discharged back to your GP.